All right. Good afternoon, everyone. This is a joint committee session of our Health and Human Services Committee and Government Operations Committee. Want to thank members of both committees for joining us this afternoon and thank Chairwoman Navarro for co-chairing this with me. And I'm going to make some opening comments and then turn it over to her to make some opening comments as well. And any of my colleagues that would like to make opening comments, you're certainly welcome to do so. We have a lot of really remarkable leaders in our community who are on this call, and we are very much looking forward to receiving 4 presentations today regarding some really important and significant work that's been going on during the pandemic, which will hopefully lay the groundwork for identifying lessons learned and making sure that we don't repeat some of the same mistakes that led to the disparities that we saw in our communities to begin with. But I just want to say from 30,000 feet and express my absolute deep and appreciation and respect for the work of our I want to make sure I get it right. Our BIPOC, which of course stands for Black, Indigenous, and People of Color, which is how we are going to refer to these remarkable health initiatives and program moving forward. And I want to thank all of you for your innovation, for your patience, for your leadership. You have always been the bridges to our communities. You have always been able to establish a deep-rooted level of trust that in many instances government cannot establish on its own. And your advice and guidance throughout this pandemic has literally saved lives. And so we very much look forward to hearing the presentations today. And what we will do is we will receive the 4 presentations. Each of you have 15 minutes to present. And then at the end, we will ask questions of all 4 groups. We will be hearing from our Asian American Health Initiative, our African American Health Program, our Latino Health Initiative, and we will also be hearing from Ms. Diane Vu and her team talking about some of their efforts to reach out to our communities as well. But before we get started with the presentations, I'm going to invite my colleague and friend, Chairwoman Navarro, to make some opening comments as well, and then we'll ask Director Kroll to make some opening comments as well. So, Councilmember Navarro.
Thank you, Chairman Albornoz, and good afternoon to everyone. I am so excited that we are having this particular conversation. It is important to note that every week, at least twice a week, we receive updates on how things are going, especially with this particular focus. But I thought it would be really important to have a joint session, and it was respectfully requested that we try to schedule this sooner than later. So I'm really excited that we're able to come together because everyone is so busy, and I understand this. Let me just say, just generally, that the efforts to date have been just simply extraordinary. This whole entire effort with regards to the pandemic really is kind of like a pioneering effort because none of us were ready for something like this. The fact that everyone immediately had to retool, rethink, get into change management mode while not having a manual of any sort is just short of extraordinary. And it speaks to the amazing capacity, the talent, the expertise, but also the desire to try something new, be flexible, to be nimble, and to be respectful of the extraordinary voices that we have in our county. It's a very diverse county, we know. And that, in my opinion, gives us an amazing wealth of expertise, and we're able to tap into so many different elements in our communities. That is why we have been able to get to the point where we are now. The BIPOC health initiatives, as Councilmember Albornoz just mentioned, they have been doing amazing work for quite a number of years. And I think that we are so fortunate to have been able to leverage that expertise to then stand up these very targeted initiatives, COVID-19 targeted initiatives. And we have seen that it has made a difference. We see it in the numbers. So I'm just so thrilled and so humbled to be part of this effort alongside all of you. I just left the Metropolitan Washington Council of Governments board meeting, and we had two very critical presentations. We had the chief equity officers from the region talking about the issue, the work on racial equity and social justice regionally. And then we also had a presentation by Stu Solomon and Dr. Crow, actually, regarding the DMV global pandemic presentation in Biodefense Center. That is something that we are all embracing and hoping to bring to Montgomery County. And I kept thinking about how critical these two presentations were and how they complement each other, because the pandemic has absolutely come to put an amazing and incredibly difficult spotlight on these persistent disparities of health in our county. It has also taught all of us that the issues around racial equity and social justice and these disparities should be on top of mind for all, because as we've seen with this virus, you know, something like this, like a pandemic, does not stop to ask you what is your ethnicity or your racial makeup, and we are all connected. So this conversation today, I think, will be really critical. I again want to thank from the bottom of my heart every single staff person, every single community member, everybody who stands up every day, wakes up and just decides that I'm going to give it my all. And pretty soon, I think we will be able to celebrate having finally totally mitigated the effects of this pandemic. And we will be able to take all of the lessons learned and continue to then build upon that and scale up some of those lessons learned as well. So with that, Mr. Chairman, I turn it over to you and can't wait to listen to all the amazing presenters.
Thank you, Chair Navarro. And I do want to say publicly, our colleague and friend, Councilmember Rice, is traveling today, so he will be in and out, but his staff is represented on this call. And he has never been bashful to text me if he has a question. So although we may not physically see his image, he is very much engaged. But Dr. Kroll, would you say a few words, please?
Good afternoon, and thank you all, Council Member, Council Chair, Committee Chair Alvarez, and Committeewoman Navarro. Thank you all for taking the time to bring this together. It's not often we've had a chance to bring these programs together in one forum. We talk all the time, but a chance for you all, for us all to hear, and for the public to hear about the good work that they've all done, especially in the midst of this pandemic, is important to date. I want to just do a couple of quick notes of thanks. One to Betty Lamb, the chief of OCA, and the staff of the programs, of all of the programs. They have all risen to the challenge throughout this pandemic, and very much appreciate that. And also for the creative thinking and problem solving of the committees. Each of the teams has brought to the table an incredible depth of knowledge and understanding that has helped HHS and the county to continuously strengthen its capacity to respond to the growing cultural diversity and with increasing competency. We as a county have gotten better throughout this pandemic at dealing with issues of our communities, and it is not without that partnership that has been that partnership has made that possible. You know, COVID highlighted yet again the inequities of our communities of color. Across multiple fronts, health being the least of it, but certainly that has been a major highlight. And the programs and the individuals sitting around the table today are proof that the county and the department is working to erase those disparities. I want to thank Diane Vu and the staff of OCP and the Regional Service Center directors for their combined work to transform that census team into COVID-19 campaign community partners. That piece of work is gaining momentum every day and really is a model for how we not reach into, but connect with the community in ways that ensure that information gets out there in a way that folks get the help that they need to save some lives. And then a last note of thanks to Dr. Chapman and the staff of NCCF for their support to the African American Health Program and their COVID-19 response. They have taken on increased responsibility over the last several months and are really showing some genius in coming up with innovative strategies to keep testing alive, to bring folks into the community and to get them connected up to vaccinations when it's time. The partners up to this point have been working on testing, health, case management, food, other supports since very early days in this pandemic. And you'll hear about some of that work. It has been stellar. And something the county should all be proud of. We in the county should all be proud of. Now that the vaccine is fast becoming available, the work, as you all know, is shifting to make sure that vaccinations reach every community that needs it, and in particular communities that have been hardest hit. These programs are central to our equity plan in the county. We need them, and we continue to need them as trusted emissaries and partners to bring messages to help deal with any kind of hesitation or uncertainty that the community might have, or fears that they might have, and to deliver vaccine into the arms of folks in communities where we as a county can't go and don't go. We can handle the big shots, the big groups, the mass vac sites, but when it comes time to get in close and get up into folks who don't get to those sites, we need these partnerships that we have in this group that are represented around this room. We have our existing relationships and contracts that were put in place. We're all about this first piece of testing pieces and all those support services. We're now moving into that vaccination stage, and so we're working to change those agreements so that we have that in place. So that is in place and will continue to be in place. I'm particularly pleased to see that the Asian American Health Initiative and the EC has given us a proposal that I think you have as part of your packet. We're working to make that a reality in this fiscal year. And lastly, I'll say it is virtually certain that the need for this work is not going to end with the end of FY21. It is going to roll into FY22. It has to continue. We won't be out of this. So we're going to need vaccination, testing, and support services for some months to come. The county executive recognized that and acknowledged that and understands that as funding from the federal level becomes available from ARPA and other sources, that funding will be rolled into this and used to continue to support those efforts. The program and the people in this room represent, for me, so much of what is best about this county. It's the strength, the diversity, and resources that's going to get us out of this pandemic and set the stage for the long road of recovery that we have ahead after we're done with the pandemic. So thank you, council members, for an opportunity to join in and listen and learn from these groups today. So I'll turn it back to you, Councilmember Albernos.
Thank you, Dr. Krell, and thank you and your entire team. I know how hard you have all been working round the clock, 7 days a week, and so appreciate all of your efforts and your leadership. Also joining us in the audience is Dr. Earl Stoddard, the head of Emergency Management Services, who I know has been working closely with the BIPOC team to carry out a number of important services. I know he's multitasking, and we're fortunate that he is on this call today. Dr. Stoddard, I didn't know if you wanted to say some words before we get started with the presentations regarding the contributions of these great groups.
No, I just want to give a lot of credit to my colleagues from the Department of Health and Human Services who have done the yeoman's work for getting the vaccine out there. And I particularly want to appreciate, and we're going to hear a lot about some of the work of the census team, of the CCC team, who is really trying to get more people engaged in the pre-registration process. It really has been an all hands on deck effort, as Dr. Kroll alluded to. And I'm just here to support them. They're doing the lion's share of the work, and happy to answer any questions that I can. They're doing the great work. So thank you.
Thank you, Dr. Stoddard. All right, so we're going to start with our Asian American Health Initiative. And joining us today is Dr. Nguyen Nguyen, Dr. Mehta, Mr. M.K. Lee, and of course, Dr. Michael Lin, to give us a presentation. And once again, colleagues, we're going to hear all 4 presentations, each about 15 minutes, and save our questions for all the groups at the end to make sure that we get through all of the presentations and give everybody the same amount of time. And we're going to try to end by 4:30 because there are a number of members of the executive branch that have to attend a meeting that starts at 4:30 regarding pandemic recovery. So let's start with our Asian American Health Initiative. Dr. Nguyen, thank you so much for joining us today.
Thank you very much, Council Vice President Albernos. Hello, Council Member Navarro, Council Member Glass, Council Member Friesen, and Council Member Cass. Thank you very much for inviting us for joining the hearing today. I'm honored to have joining with me my colleagues, Dr. Michael Lind, Mr. M.K. Lee, and my vice chair, Dr. Mehta, have sent her excused because she has to travel today. So together, we are three of us will share with you, will follow up, and we'll share with you some activities that that the Asian American community and NGO has been doing in the past years. I cannot believe that the pandemic has been with us now. We talk about years now, and we would like to share with you some of the help that we need, and looking forward to have your support. We're honored to be here today to represent our steering committees and our AHPI community at large. In the previous meetings, we have shared with you about the needs that Asian Americans have. As other community, Asian American experience an impact badly by the pandemic. And recently, with all the rise of the anti-Asian hate crime, it's put the tremendous stress to the Asian American community. For the purpose of our hearing today, I would like to focus on two topics. Number one is, what have we done in the past year to address the need of Asian American community, especially the good work of the NGOs that work in collaboration with HHS and other government agencies to provide a need to the Asian American community. And secondly is about what specific area that we seek for your help, and that will reflect in the proposal that we share, but that we want to elaborate more and want to take your question for those. For the first part on the work that the NGOs have done for the Asian American community, I want to highlight a few really great work that have been done by different individual organizations, and then I will share with you why I do so. First, one of our major NGO partner is the CCACC Pan Asian Health Clinic. In the past year, the CCACC have provided over 20 COVID-19 health-related Zoom webinars and 13 disease prevention seminars. There, all that they have helped over like 2,400 people who participate in those webinars to help them learn about what is going on with the COVID and how those impact their health. And all the video that they recorded that have over 10,000 views. On the COVID service side, CCACC have provided testing for almost 2,000 people and also do all the screening activities. So far, their clinic have vaccinated to almost 1,000 community members there. Other COVID relief effort that CCACC have done has been provide since March 2020, 730 calls and answer the call and support for the community members on their question related to variety of need and support, because a lot of time people don't know where they can get the service that provided by the government due to the language barriers. Another partner NGOs that we have is American Diversity Group. In the past year, they have provided over 20,000 COVID testing at their Super Spring local location in partnership with their partner Angelize and Asthma Adult Daycare. They have partnered with Safeway and Walgreens to deliver 210 vaccines in the month of April and just the past weekend. And they provide food support for over 26,000 families in Montgomery County. The third partner I want to mention too is the Korean Community Service Center. And together, since last year, they raise funds. They're working together with their community. The model: those who can help those who cannot. with that, they raise funds to provide rent, food, and utility assistance for almost 700 individuals in the Korean community. And together, they also provide safe and healthy food for over 150 families in Montgomery County. The next organization that we talk to is the Association Vietnamese American. The Vietnamese community also had been encountered a lot of challenge in the past year. This organization had provided the vaccine clinic last month for 161 people, and they help every month. They help between 500 to 800 individuals to sign up for different services in the community, including food stamp, unemployment. So those activities together has been really addressed a lot of need and just tell us that people do go and seek for those support. So why am I bringing up different this organization and the work that each of the organization do? The reason is two things. Number one, I want to highlight that the needs are high. People are there. People go and work with us because they have help. Sometimes the data on the number of cases, the number of deaths do not accurately reflect the need in our community. So I want to share with you those data because that is telling a different picture about the need of the Asian American community. And the second reason I bring up different organizations because I want to highlight that we are Asian American is a diverse group. There's no way that one organization can hit all the need of the diverse Asian American community. That's why we need the NGO's partner who has expertise and access and trust of the community so that they can effectively deliver that kind of service to the community. By no means that this services be delivered by themselves. I mean, that is a strong partnership that they have with the county and with each other as well. The community has been working together to coordinate the effort for the COVID vaccine, which is something that we want to really highlight and we want to build on moving forward. So, and one more thing that I want to mention about this work they have done so far is this effort has been coordinated, organized a lot by their own, and they have so far received little help or just a little help from a funding to support their activity. So many organizations have mentioned that they either self-raise their fund or they are using resource from different activities to support for the COVID-related activities. So they have been stressed out, they're concerned, and they raise those concerns to us. And this is one the area we want to bring up to you and ask for your help. With all those part activity we do, we address both the physical health and the mental health aspect of it as well, because as you realize, the recent rise of hate crime really bring a lot of concern to our community, and people come to us and say, how do we deal with the situation? How do we help our community on those? So our NGOs has been the front line to address those needs. So turning to the second part of the purpose that we are here today is we do ask you for your help. In the activities that we, in the proposal that we raised, as we sent to you, we have laid out some specific activities that we hope to receive the support from our council. Number one is the education. Right now, education for COVID. So far, we vaccinate over 30% of the county residents, but we still have a long way to go. We know that the remaining number that of the unvaccinated one, a large percentage of them may be very hesitant right now. So we want to be sure to prepare our community organization to help inform and educate our community, especially those who are hesitant to get vaccine, so that they inform and move forward to receive a vaccine. We want to address the mental health issues, as I brought up to you earlier, and we want to work. The funding can help to build the capacity so that we can do a better job in health prevention and continue to keep our community safe. And all of this, what we propose in that proposal that we sent to you is really the focus is aligned with AHI blueprint that we have. And we shared with you the blueprint last year. This is our strategic vision that AHI wants to move forward in the next 10 years, focus on health prevention. So that's the direction we are moving forward with this proposal. In conclusion, I just want to share with the council members that a lot of time, good things don't happen by accident or by itself. This is a lot of effort that's been done behind the scene. And sometimes unseen efforts may be forgot. What I fear the most is if we don't provide the support for the good work that's been done and look forward in terms of the prevention approach, we will go backward. And that's what, and I'm fear that if we don't do so, the community, as the Asian American community, may regress. And then that can become a bigger problem and bigger challenge, more costly issues that we have to deal with in the future. I close there. I want to pass it to my colleagues, Dr. Michael Lin and Mr. M.K. Lee, if you have anything else to add.
You're on mute, Dr. Lin.
Sorry. Well, first of all, thank you so much for the tremendous effort that the county and then especially recently County Council engaged us in this major challenge of the century. I just want to make two quick comments. One is about this particular virus. We are lucky that we were able to develop a very effective vaccine within a year or so. Okay. And give us a feeling that there's an end, the light at the end of the tunnel. But I must say it's going to be a long tunnel because this particular virus seems to be, this is the first chance to engage human species. The challenge of that is that it's going to multiply, mutate. We can count on a few variants for sure. So one big question is that the virus and the vaccine we have, can we stop all of them? Or we need to booster or something else to deal with it. One thing for sure is that it's not just going to be another flu. Okay, so that's one thing I just want to caution us because we want to be prepared, as a community to educate this. And the second point is about its impact. So far, it seems to be on the lung and the heart, right? But the indications are it probably impact on mental health. That is more difficult to deal with because it's mental health, not just one isolated organ. You can aim in that. And the first indication is that once infected, you tend to lose taste bud. And more recent indication seems to lose some memory too, okay? And just the stress itself is already going to impact on the brain in so many different ways. And other words, there will be a lot of issues related to mental health. And I just pointed out one effort our AHI has been doing last few years is that we produce a booklet. and very simple language, and then look very attractive. And then, unfortunately, I cannot pass it on to you, but just quickly simply say, more than just stress, right? Mental health, right? And we even translate into 3-4 languages. Yeah. The good thing is that it's very popular because it's so short, easy to read. And then this is probably one of our best sellers, yeah, in terms of reaching out to the. And the important thing is that the effect of this virus is revealing itself, I don't want us to sort of brush it aside. It's almost just another mental health. Yeah. And with the anti-Asian recent event and so forth, we realized that just like other community had to deal with, that typically it's a deep-rooted kind of challenges. So I want us to be prepared that this is more than just virus, more than just stress, and we can use some new resources to deal with that. Okay. So thank you very much for the time.
Thank you both. Such important words, such a great presentation. And again, we're going to ask questions after all presentations. Next, we're going to go to our African American Health Program, and representing AHP is Dr. Chapman, as well as Arlie Wallace.
Good afternoon. Let me pull up my PowerPoint so I can paste my presentation to this illustrious group. I'm very honored to represent my colleagues and reporting out to you this afternoon. And so you can see we would deem this the integrated services and supports for residents across Montgomery County's Black community. And I really do want to thank Durkin Rosarian and Arlie Wallace, my county colleagues, because this has been truly a team effort at every level. I also want to thank my executive deputy, Ralph Belk, who is with us, as well as my millennial MPH from Indiana U, my director of QA, Jasmine Morgan, who is the data brain and the policy brain, who has partnered with me, along with Alicia Hunter, who is our lead, COVID lead initiative person promoting the integration model altogether. So thank you for allowing us again to talk to you. This is a very important issue. As you well know, NCCF is an old orphanage, now a regional family and child agency. And so anything affecting children and families and their parents and youth would be aligned with our mission. And so as you realize, and you've already heard, that this COVID phenomenon is impacting the Black community in some special ways. Within the state, this is what started the conversation. The council was really quite wonderful. Council members Rice and Joanda, all of you were very wonderful to understand that there was a special impact on the Black community, and there had to be a country-specific targeted response. The AHP Executive Committee advocated for the creation of this emergency public health response, and you approved it on August the 4th. I just want to do a real replay really quickly so we can get into where we're going. And the NCCF, we became the fiscal sponsor at that time as the sole source to ensure that the funds awarded by the council were used for this very specific effort that was laid out. It was laid out in this kind of way. As you may recall, council members, we really had the COVID testing was key and still is key. However, we had prevention and safety kits. We had addressing the food security issue, community-based referrals, including mental health, the creation of a Black Physicians Partnership, and of course, how do we get the word out? How do we market, and how do we educate? So I would describe the first phase, and that really began like in September as ground zero. There was no infrastructure in Montgomery County for the Black community, no infrastructure to allow us to kind of use those localized clinics that Black folk frequented. We had to start from scratch. And so the key was to establish key partnerships and locations and local churches and community sites where folks would feel comfortable going for this free testing. And so we did. We facilitated site-based and popped-up COVID testing services. We provided at that time in this first phase, we call the launch, in-home 2-week food supply for all those who tested positive with COVID, with a recognition that they don't need to go to the supermarket and struggle to figure out how to eat for 2 weeks. They need to focus themselves and their families. Conducted marketing, communications, education, outreach services. We reached out. And so we also put together COVID safety kits that are very popular. And we looked at how do we connect folk at the test sites to resources. That was phase one. Phase two, which relaunched again in January, we learned from phase one. And what did we learn? We learned that we need to distribute food to all the residents who show up for testing and for pre-vaccine registration activities, because now we do that along with testing. We will help register anyone who shows up for testing or just shows up for pre-registration activities so they can get connected, but we make sure they have food. And so here you see the COVID kits, you see the food, they're attractive. I think just in March alone, I was looking at our numbers. In March alone, we probably fed at least 1,300 bags were given out for food. We also continued our testing, and I think just in March alone, probably about 1,200 were tested. But we also began to see the pre-vet registration group begun to show up, and that number keeps growing. I don't have it right before me, but I think just in March, because we just started that, we had several hundred. Communications, we revisited our marketing and our communications, aspired by some of our colleagues to be very country specific. We upped the grade on that, and we redid the website and also began to market toward very specific communities within our diaspora, meaning that African American is a very specific word, but it doesn't necessarily resonate with the variety of folk who identify within the Black diaspora, African Caribbean and African American. So our communications and our outreach are getting more targeted very specifically to groups within our Black continuum. And so we've also added new education outreach partners during this phase. So we have 7, and you can see them, the Phi Alpha Fraternity, Design Peace, Ethiopian Community Center, Hazel Crest Holdings, Minority Veterans Research Project, NAACP, and Omega Psi-Phi, Mu Foundation. So we have added some new folk to our group, and we meet and we talk and we have consultation on the part of our marketing partner, our media marketing partner, in consultation with some of these folks on how to really enhance social media and getting the word out. We have about 51 outreach stakeholders across 33 separate organizations, and we distribute marketing blasts from our centralized approach. They get, every Monday, we get a blast around some flyers, what's going on, what links, what they could do with their information, et cetera. And here's an example of some of the marketing imagery. All right, and this is some of the marketing imagery. You know, I've been taught free is a great word in marketing. We're free with specificity. So this is free test, free food, free swag, and free pre-registration. And we've been doing that now for the last, I think, 2 weeks or so, 2 or 3 weeks, and we're seeing a response, a very positive response. And again, some of the marketing imagery, some that's specifically culturally targeting the Black community. Another thing that's really important, and Jaslyn is also, Morgan is also on the line somewhere, but we're really putting a lot of emphasis on streamlining our data collection and reporting processes. So we have now very specific reporting processes that allow us to will accumulate aggregate information that will help us evaluate our service delivery across these different domains, because this integrated model is quite a challenge, but it's also quite effective. Guide the equitable distribution of vaccination resources, increase utilization of community resources, and improve access to culturally tailored medical services among Black residents. So we need to have the evidence. We are going back. We've gone back to from the time we began and moving forward in a more streamlined approach. We have a researcher on the team, Dr. Nanda. And so we're excited about that. In this phase 2 refinement, we also took a look at the mental health services. How are we going to promote that? How do we connect our community referral, our primary partner, Pride Youth Services? How do we connect them to those who test? How do we, in fact, make sure that folks may come up with a negative test, but they know how to get to a vaccination, or they also know how to get to other county resources, of which there are numerous ones, that often the Black community members don't utilize because they don't know about it, or they don't know how to access it, or they're not encouraged. So part of our innovation around the mental health piece is the call-in line on our upgraded website, extending our services to youth who are stressed out by all of this, whether they test positive or not. They're stressed out about the COVID impact on their education and their social life, and their family stress gets passed on, parental stress gets passed on, no matter what parents try to do to avoid doing that. So here's some examples of the marketing material around that: anxiety, mental assistance, food, find the doctor, what do you need? We've also done something that I think is really exciting. We have 2 nurse navigators who are full-time who increase the time of response on test results, so they can get the test results to those who test really rapidly. And again, they can also make sure the food gets to those who test positive, or those who live in the county who get the food within 24 hours. And making sure, again, that they are knowledgeable of what kinds of resources could be connected to the folks who they call around the test result. So we're trying to do multiple contacts. We contact them when they're on site. We call them maybe before the result, and we certainly call them with the result, and continue to encourage, how are you doing, and what do you need, and how can we link it up? The Black Physician Partnership was initiated in the first phase, but now we're looking to expand it. And I don't know if Dr. Carl or Arlie will talk to this, but we're expanding that team. And we have some physicians who are getting quite excited about this. How do we make a connection between our testees, those who test positive or not, those who need a primary physician? And we do know that Black physicians have unique outcomes in some cases with Black clientele. So how do we make that connection? If they have insurance but they don't have the copay, we will pick up the copay. All right, we'll pick up the copay on 2 occasions. But we're looking to advancing our relationship with the Black physicians, because we think that that is a very important resource that needs to be further developed in the county. We now have a position, a specialized coordinated position, and we are in the process of interviewing and finalizing the person who will take on leading this within the model. We're excited, and we are excited because several of the candidates have experience selling pharmaceutical supplies to doctors, or they have nursing backgrounds and they've worked in many a physician office. So they will know how to create that link between the AHP model and the physicians. We're very excited about that. We're looking at an in-home vaccination medical provider. And again, the county leadership may talk a little bit more about that. That's something exciting. Our position is that there are many Black folk who can't get to and can't stand in line and don't want to leave their house, or they're disabled, or they're immobile. And do you have them be picked up and taken somewhere to wait, or do you have someone just go and give them a shot? All right, test them, give them a shot, and if they have other kinds of needs, and don't have a primary physician, connect them to BPP. So we're also, again, Durkane leads us in coordinating with the state's equity task force and the FEMA strike teams. Moving quickly, we have been, since November, tested almost 11,000. Almost 9,000 of them were county residents. We've had 96 COVID testing events. We've had, here's the number, 643 vaccine pre-registrations just since March, when we just started doing it. And we have 26 testing site locations. Moving forward, and I'm going to begin to wind down now, the expansion of COVID testing and vaccination pre-registration locations to 30 sites in targeted zip codes. I believe we have more than 30 sites now, but we're looking at targeted zip codes where we're going where the Black community is. Some of our churches, although they may be Black churches, they're in multiracial communities, which is fine, and we certainly support those communities, but we want to not miss access to those Black communities by not going to where they are. So we want to target those zip codes that have more risk and more vulnerability for this as a Black participant in Montgomery County. We're working with the OCP regarding diverse and increased engagement, and we're already getting some good response from OCP with going into those communities that are kind of locked out of mainstream activity in the county in terms of using resources. We're looking at, again, you've already heard, expanding it for both office and in-home vaccination opportunities. And we are going to analyze this data so that we really can have a handle on what happened, what worked, what can we generalize more, and what do we need to continue to tweak and squeak and refine, because again, in October, we were ground zero. So that data is important. How have we penetrated the zip codes? So I just want to begin to conclude now with some of the challenges. There's not a lot of Black serving organizations. Transportation is, as you all well know, is a problem in the county. We have to identify more locations in the Black community, and we are making progress on that. The mobility we talked about and the lack of technology access or literacy. So as I say goodbye to you all around this report out, we're looking at 43 partners in just a few months. So we know that the community cares and that they understand the village approach and that we all must care about each other because we all affect each other. And COVID certainly teaches us that lesson. So I just want to, again, thank Durkane and Arlie for their partnership, as well as the NCCF team. And most importantly, thank the council for your investment, your focus, your support.
Thank you very much, Dr. Chapman. And we'll have questions at the end of all presentations. Was there anybody else from AAHP that wanted to make some comments before we go to the next presentation? Nope. Okay. Well, thank you again so much. Now, next, Arlie, there you are. Good to see you.
You're doing, Council Member. I do want to say, just on behalf of everyone, I do want to thank the council as well as the Operation Committee for allowing us to come today, and to also to give some other insights on the operation of the African American Health Program. Even though we do have a tremendous partnership that we've established with the advocacy of the African American Executive Board, the African American Health Team also has a great presence in the community and working at some apartment building sites with allowing testing, as well as trying to emphasize the issues in which our seniors has faced with food insecurity, and also looking at the fact that we've been working very closely with Holy Cross Hospital since the vaccinations has become available, and making sure that we can get those hard to reach population who do not have access, as Dr. Chapman mentioned, in regards to technology, that we have been helping and enrolling and then referring them to Holy Cross, who has really been a key in administering the COVID-19 test, vaccinations, as well as working with the health department in doing our pilot projects, especially in like the East County area, that was extremely hard hit in area code and zip code 20904. So those are some additional projects that we have been actively engaged, as well as looking forward to doing some communications type plans in the future to try to address hesitancy, in which we know is going to be very present in the Black community, and making sure that we can try to address those issues that are underlying when it comes to our chronic disease risk factors based on cardiovascular disease, as well as hypertension, obesity, and as well as stress, which is very prevalent in the Black communities across Montgomery County. So I do want to just thank you all once again, and thanks Dr. Chapman for stepping up to an even greater leadership as we try to continue to implement the services across Montgomery County. Thank you.
Thank you. That was super helpful. I appreciate that, Arlie. All right, we're going to move on to our Latino Health Initiative. We are joined by Monica Escalante, Maria Gomez, Dr. Elliots, and Dr. Ana Maria Izquierdo. And we also have Sonia Mora here, representing our HHS team. So why don't you all take it away?
I think I'm going to get started, and if I may share a little PowerPoint.
Actually, Monica, before we get started, Maria Gomez shared some big news recently that she is going to be stepping aside from her role at the Mary Center. And Maria, we're going to do something more formal for you in the future, but this is the first time we've had a chance to see you publicly. You are an inspiration to so many of us, myself included, and I just want to thank you for your just generation of leadership and innovation on so many different levels. There are hundreds of thousands of families across our entire region that just bid you thanks. So we will be doing something more formal later, but I didn't want to miss the opportunity to just say a few words of appreciation. So thank you so much, Dr. Gomez. With that, Monica, sorry about that.
That's very, very well deserved. And I will talk more about the partners, the amazing partners that we had. So my job today is to make you a little more proud than you might already be, because the previous two presentations should make you proud, very proud of the work that has been done when communities were hurting and you stepped up to the plate and did something about it. And we're very, very grateful for that. So please take just an inhale of pride as I go through this presentation to hopefully increase that a little bit more. This would not have been possible without your support. So, and I want to especially thank Councilmember Navarro and Councilmember Albornoz. A year ago or so, you felt the need in our communities and you called us to do something about it. And boy, we have responded. So let me share my screen. And so hold on one second, because I think I have to share it first or make it into. Can you see it? No, you cannot see it. Okay. Screen 2, share. Come here. Can you see it now?
Yes.
I cannot see. Okay, perfect. So if you want to talk to me, please talk to me, because all I see is screens. I don't see you. My pleasure to present this little summary of what we have done in the previous months. Again, thanking the council for this opportunity and thanking the partners. And I will elaborate more on the partners that were just amazing. So let me start with some numbers here. COVID-19 testing administered is 73,161, and these are as of April 7, 2021. The vaccines, 1,200 approximately, and this has been a partnership with some organizations, and we did both Pfizer, Moderna, and JJ through Salud y Bienestar. Hospital at home, and I think It was mentioned just a few minutes ago that there are some hard to reach patients, and this is the hospital at home that has reached 38 patients so far. And the case management service, 7,949 individuals. So services addressing mainly food needs, financial and housing assistance, and general health and clothing supplies. Other highlights is calls, field by information by the telephone line, over 6,500. Bilingual information provided, 8,000 referrals for COVID testing. And we also did a pre-registration of 2,800 Latinos for vaccines. On the outreach activities, we have the health promoters conducted face-to-face interventions in apartment complexes, supermarkets, and testing events, churches, as well as community centers. We think we have reached over 160,000 Latinos, and we educated over 92,000 with information and referral services. Now, my predecessors, the other two initiatives, we're talking about creating an infrastructure to respond to the pandemic. And this is part of that infrastructure, people going and doing this work one-on-one, and also through a large social media campaign that was launched that reached over 500,000 Latinos through Facebook and other, the website. I put a little insert here of the website that you can see. These are the characters that were created, and they tell a story. So it's a couple, and they are the grandparents, and they're educating other grandparents on how to handle the pandemic, how to think about their daily safety as to using a mask, hand sanitizer, and 6 feet away, or whether they were going to get vaccinated and the things they can do now that they are vaccinated. This has been a very successful campaign. As far as the vaccination testing related activities, we are promoting a dual message right now. So it's important to be tested, but it's important also to get vaccinated. And we're engaging in testing sites and spreading them in targeted zip codes all around the county. We're identifying established and new possible vaccination sites. And by monthly, April 19, all clinical partners will be administering vaccines after completing the training required. And this is a great partnership with Health and Human Services as well. Salud y Bienestar Partnerships is expanding beyond the partners with Adventist Healthcare, where there's been an event for vaccinating 300 doses at the Tacoma Park facility, and the second dose is coming up later in April. El Salvador Consulate is a bi-monthly testing events that they are doing starting on April 26th. And then Angaraí International provided technical assistance and the setup of testing and vaccination events. So you have in front of you the logos of the community partners, 9 great organizations that have stepped up to the plate. And look, the county is right there, very important partner. And this collaboration is based on education, is based on a partnership that we want to think moving forward. And it's been already mentioned, the mental health crisis that we are facing and that will just get accentuated. So the partners are thinking about that. In addition to, it's also been said that this is not a flu that will go away. This is something that will continue to affect our communities. And we want to tap on the infrastructure that has been developed to use it to continue what we're doing and improve. I mean, we have amazing channels of communication to reach out to our communities. You just saw how 500,000 Latinos have been reached through all these efforts. And before I remember, there was always challenges. The county had these services, but we couldn't get the community to learn about them. Well, now we have channels of communication to reach out to all of the communities. It is my pleasure to also thank the partners, and I'm going to specifically mention Maria Gomez. It's been an honor to work with you and learn from you in this process. Dr. Elliott, you've been great. Thank you so much. And Dr. Ana Maria Izquierdo, that really goes to the places nobody else would go and reaches out to those aging Latinas and families in a way that nobody else knows how to do. So that's my segment of the presentation. I just want to highlight that we will come up with a proposal to how to further these efforts. throughout the rest of the year. And now I'm going to turn it to Maria Gomez. You're on mute.
Thank you so much for the kind words, Councilmember Albornoz and Monica, and to all the members of the council. Thank you so much for this opportunity. I think that we today, as you saw with all the presentations, really, and with the Latino initiative, is that I think there's so much that has been done, and yet so much that still needs to be done in this community. And so I want to thank you, all of you, for giving us the opportunity to really like go out all the way out and do our best and use our minds and our heart in all the many ways to reach the community that is so desperately in need. So Dr. Elliott, I want to introduce Dr. Elliott. He's our Chief Medical Officer at Merit Center, who has been instrumental in making sure that he guided all of our teams through the Proyecto Salud and Bienestar. And so I just wanted to give you an overall view of Merit Center. Was established in 1988 to really address the issues of the newly arrived immigrants in that era. And so as you can see, the little red dot is where Montgomery County is, where our site is at 344 West University Boulevard. And just overall, Merit Center seeing about 60,000 people throughout the DC and Maryland region. At the Maryland region itself, I think we see almost approximately like 14,000 people. We have 5 full units, 2 of them in Maryland, 1 of them in Montgomery County. Like I said, we're in school-based clinics, which we'd love to be able to bring to that expertise to Montgomery County at some point, and 2 senior wellness centers again. And we partner in all of our sites in DC with charter schools. So anyway, a lot of work that Merit Center is doing is around not only addressing the needs of healthcare, but addressing the needs of social services and education for our parents and our children, to make sure that families are really socially and economically moving up that economic ladder, as we know that's how we get better health and better health outcomes when our education level and our supports in the community are better. Next. Okay, so I was going to have another slide there that was going to show all the services that we have, but go ahead, Dr. Elliott, because we don't have a lot of time. So let's talk about the work that we do.
Yes, again, thank you. I won't take the time to thank everybody, but thank you. That's the biggest thing I could say, is that I wanted to highlight some fast facts. I think the most important things to take about here is it's a very dynamic organization. And absolutely, to what Maria's point was, that we are having a major impact in terms of the communities that we serve. And so what I'd like to do is I'd like to actually bring everybody's attention over towards COVID testing. By itself, we've tested 1,813 people, but when we added Salud y Bienestar and the efforts with that, it really supercharged the process, because you saw it ramped up to 14,000. And the positivity rate is relatively the same, but even with the vaccination efforts, you can see that we've done 501 doses. Those are with federal and state vaccines, 477 unique patients. We did have a significant number of Johnson & Johnson. And 84% have been Hispanic and Latino, 5% Black, 22% white. Overall, 97.4% have been a racial and ethnic minority. There's a little factoid I put at the bottom. Of the pregnant women that we have tested for COVID-19, 45% have been positive. That is a remarkably high positivity rate. And fortunately for us, we've been able to stay engaged. And I do think that our efforts, even with the external efforts outside the building, have allowed us to capture these women and keep them plugged in and make sure that they stayed in care. See if I can get this to go to the next page. There we go.
That's okay. Go to the next page. I think that's just an illustration of all the services that Merit Center has to address as people come in for COVID testing and for vaccinations, that we can offer them the services. But go ahead, next.
All right. So the plans, we're looking to do an on-site freestanding vaccination clinic where we can get up to 400 people vaccinated in a day. On days that we're not doing vaccination, we would seek to use that for testing. We have a mobile vaccination process where we're looking to get at least 200 a day. We find that if we go beyond the 200, it does become problematic, but we want to make sure that we're finding targeted communities where the positivity rate is high. We're seeking to do enhanced telehealth services, medication-assisted treatment services, HIV services, workforce development, because certainly everybody doesn't have the staff that they can just immediately pull out of a closet and start vaccinating and testing right away. So there's opportunities there to take non-traditional workforce and get them into the space to do testing and vaccination. Looking to partner with Shepherd's Table, especially with the homeless population, for behavioral health, dental services, and telehealth services, almost in a pop-up level for a telehealth kiosk if it works. And overall, in order to make all that happen, there's permits that need to happen. We have a lot in our Silver Spring location. And of course, we have neighbors that are very passionate about their community, but as soon as they see a tent pop up, they might be concerned. So we do need to get some sort of element of expedited permitting process to make sure that we can vaccinate more people and certainly test more people. Technology upgrades. Paper and pencil, we're not on paper and pencil right now. We're not sitting in front of people. And so having these technology upgrades like iPads and other things to expedite the process of getting people enrolled would help. Vaccine cooler. It needs to be a special vaccine. It needs to be a special cooler at a certain level to make sure that that vaccine supply stays stable during the day. Tenting, same thing on that site. Portable medical spaces. There are capacities and there are options out there where you could actually park something on a lot, and when you're done, you take it away. It doesn't have to be a permanent structure, and it's definitely not unsightly. Signage. One of the things that we've encountered is that people can see, they know where we are once they're there, but it's not hard to miss us if you're driving down the road. So that signage makes a big deal. And so the biggest thing about all of this also is ongoing site selection for vaccination efforts, whether it be mobile, whether it be large scale, or whether or not we are participating in a mass vaccination effort with other organizations. So, consistent with our mission to embrace all communities and provide high quality healthcare and social services to build better futures, we're seeking to collaborate with Montgomery County. I left out education because it was blocked by the Zoom thing. We're seeking to collaborate with Montgomery County to fulfill a promise that all residents to meet them at their fullest potential, which is essentially health equity. Participant centeredness, accountability, respect, and teamwork is the only way we're going to get there. Thank you. Maria?
No, I'm good. I would just say that our 5 minutes are up, but I just would say that the Mayor Center is ready, and we are going to be assigning a whole team of just vaccinators that can actually do this process as many places. And one of the things that I had discussed with our team is that we will be asking today that between the project Bienestari and the council is that we need as many sites where we can do actually large events for vaccination. And I'd love to offer the van, it's a brand new van that we got from the federal government to make sure that we can go in places where we know that people are at high risk, and that we can now vaccinate the whole family. So thank you.
Thank you, Maria, and thank you. Monica, next.
Yes, and next is Dr. Ana Maria Izquierdo. And before, and that will be the last intervention, but before we go to Dr. Izquierdo, I want to thank the LHI staff and Sonia Mora, which, they work tirelessly to keep this all together working. Dr. Izquierdo, yours.
Thank you. So unfortunately, I'm in the field today, so I don't have a PowerPoint, but I want to share the work of Care for Your Health. So as you know, Care for Your Health is a multicultural senior organization. And for many years, we have going to people's homes and taking care of people wherever they needed to be taken care of. And when the pandemic came, we were ready to just be part of the solution. So first go the thanks in this piece. And I want to thank all the county council reaching us and saying, please be part of the solution. Particularly Nancy and Gabe have been instrumental for Care for Your Health. And also, as Monica said, for us, the partnership with the LHI and the commitment of the LHI staff, all the way from Sonia to the bottom, to all of them, has been phenomenal. So thank you. In terms of Care for Your Health's participation in the pandemic response, we have conducted to date over 25,000 tests, all of them in the community. We have established partnerships with churches as well as living facilities, so apartment complexes, and we go to their community and we offer tests. In March, we started a pilot to work through the kinks, what it would look like to partner with a county in terms of vaccinations. And another thank you here, I have to thank the Healthcare Initiative Foundation, who has stepped up to fund a lot of these initial efforts to work through the kinks and establish the infrastructure for us and for other members of Montgomery County community to be able to respond to this. To date, we have vaccinated, we have administered about over 1,000 vaccines, and we have three main sort of sites. One is what we call individual homes, all right? We go into someone's home and we vaccinate. We try to vaccinate everybody in the household, but it depends, because when we were in different levels, we couldn't. But we vaccinate individuals in their homes. Then we have events in senior, independent senior apartments, where we go to the home, but we don't knock at each door, but they come to the dining room or whatever it is that we can do the vaccines. And then we have done community vaccinations in Stedwick and Black Rock, etc. So we have learned a lot. We have been able to establish. We want to thank the HHS for providing us the vaccines to date. We actually are working with the Equity Task Force, and we'll be starting to vaccinate in Wheaton next week with vaccines that are provided by the task force and not directly by the county, so that we bring more vaccines into the county too. And the other thing is we have continued all our testing efforts. So we continue to tell people, don't, forget that just because you're vaccinated doesn't mean you don't need to get tested. You don't need to cover yourself. You don't need. So all those efforts, which have been a lot of partnership with the Por Nuestra Salud y Bienestar communication teams in TV and radio, and showing up and showing a known face in the community, which is not my cup of tea. But I show up because it's important for people to know and to hear these things in their own language and for someone that they know. So these are the efforts. We look forward to increasing the vaccination through Por Nuestra Salud y Bienestar. We are ready. We have tons of sites. We're actually meeting this week with the Latino Restaurant Association to make sure that all the workers in the restaurants are vaccinated. So when the county opens, they're all safe to go to work and provide for the county. So a lot of exciting stuff happening, and we're just waiting for the vaccines. So we are ready to go and step to the challenge of this next upcoming challenge. Thank you.
Just wanted to add, thank you, Madam Doctora. I think that one of the things that has been really, really important in the success of Por Nuestra Bienestar with LHI, first of all, like it's been said, the staff, but I think also is the partnership with them and the rest of the government leaders like Dr. Crowell and others, in making sure that people have the testing, and that they have the vaccinations, and they have the food, and they have the rent, and they have all the pieces that are so crucial to getting people to get vaccinated. So thank you to Por Nuestra Bienestar, but also to to the rest of the government people that have just been extraordinary to help us solve all the issues that need to be addressed with our community.
Great. Thank you so much. Again, we're going to ask the questions at the end. Diane, you're next up.
Great. Thank you for having me here today. So let me just first give a round of applause to all of the MHIPs for all of the work that they've been doing. They have just been incredible. So, you know, the role of our office is to support the work of the MHIPs and HHS. We've continued the CCC model. So what was once called the Census Complete Count Committee is now called the COVID Community Committee, and what was once Be Counted is now Be Healthy. So sorry, the B is not going anywhere. But this approach really allows us to take a granular approach to our outreach and to continue to target specific communities by geography, location, and languages spoken. I should note that Ken Hartman is also in attendance today, who's been working very closely with me to lead these efforts, and so is Sean Ellis from my office, who was once the census manager and is now overseeing all of the CCC work. So as you've heard, this really truly is an all hands on deck approach. I mean, it's facilitated by us, but it is a very close effort with everyone from HHS, the MHIPs, the Public Information Office, the nonprofit partners, the RSC directors who are chairing the regional subcommittees, down to our community liaisons, faith community partners, civic associations, and people who are just helping their neighbors and family members get pre-registered. So, you know, the CCC, when it was established, was a broad representation of folks from a large cross-section of sectors, so nonprofits, businesses, philanthropy. There were 142 members that represented the county. And we went with the all hands on deck approach because we knew it was going to be all hands on deck. The average CCC size in other jurisdictions was 15 to 25. And we recruited as many folks as possible to serve as trusted messengers. We're continuing that model moving forward. The larger CCC is broken out into the 5 regional subcommittees, as I mentioned. They're chaired by the regional service center directors and co-chaired by the community liaisons. And the reason we do that is so that we can, again, take a granular approach both by geography and also by language and demographics as well. So the overall goal is to obviously get as many people in the county vaccinated as possible. The 5 regional subcommittees have been meeting very regularly, some of them once a week or bi-weekly for the past 2 months. And there's 3 objectives here: promote the vaccine and to be a conduit of a trusted source of information, both from the county to the community and also vice versa. So it's a 2-way communication channel. Secondly, to get as many people possible to get pre-registered, both through in-person and digital outreach. And third is to recruit volunteers. So the volunteer center that's run under our office is serving as a central point of contact for the county for all volunteer opportunities that are related to vaccines. The volunteer center team has been working very closely with OEHMS, MRC, and HHS as well, and also the CCC subcommittees. So those are the 3 goals and objectives of the CCC. So like I said, there's 2 pieces. One is the digital presence and one is the in-person outreach. I'll talk about the digital presence first. So we're creating and distributing information in the top 7 spoken languages in the county. So, you know, English, Spanish, Chinese, Korean, French, Vietnamese, and Amharic. We're obviously letting LHI take the lead on the development of the Spanish materials, and we're supplementing the work in the other languages as well. We are encouraging distribution of information through newsletters and also social media. And we're also using in-language media outlets such as radio and newspapers. We've also been working with PIO on text messaging strategies as well, and we're working through our nonprofit partners to do phone banking, which was something that was pretty successful throughout the census. So for the in-person outreach, we're targeting low pre-registration and high impacted census tracts and zip codes. So Aspen Hill, Wheaton, Fairland, White Oak, Long Branch, Montgomery Village, Twin Brook, Lincoln Park, and Germantown, and Gaithersburg. The multilingual volunteers, in addition to the nonprofit partners, are really key to the success here. The volunteers are using technology, so they have tablets and they have posters with QR codes that people can scan from their own tablets from a safe social distance when we're at these in-person events. Again, we're adhering to social distancing guidelines, right, and ensuring that both our volunteers and staff and also the folks that we're speaking to are adhering to social distancing guidelines. So we started our in-person event at Mount Calvary Baptist Church on March the 6th. There was a distribution of 2,500 flyers to the surrounding neighborhoods in the days leading up to the standalone pre-registration event. This was a partnership between the BCC subcommittee, the city of Rockville, and LHI was there, obviously along with HHS staff, and the volunteers were provided through MRC and also CCC members as well. So since then, we've continued to provide in-person assistance at events that are already happening. So instead of doing standalone pre-registration events or standalone census events, we're tapping into what's already existing. So food distribution events. We were at the Fitness Expo at the Tacoma Park Rec Center last weekend. And this week we're pivoting to focus on international grocery stores because the international grocery stores were also very key during our census outreach. I can't stress enough how critical the nonprofits have been to our efforts. For both the success of the census and our continued outreach couldn't be possible without these nonprofit partners. I mean, you've heard everything that NCCF is doing, along with the nonprofits that Dr. Nguyen and Monica mentioned. So I just want to thank them publicly for their dedication and efforts, and really they are central to the success of our outreach, not only because they are culturally and linguistically competent, because they are trusted sources of information and places that people can feel safe going to get services. And I can't thank them enough for everything that they've done. And lastly, I want to mention the work of the Community Liaison. So not only are they supporting all of these outreach events and co-chairing the CCCs, but they've been very creative with their work. So our Asian American liaison has been tasked to oversee the outreach to the grocery stores. And they're working very closely with, OEHMS and HHS on that, and also the health initiatives. Our Latino liaison has been in conversations with the consulates and how we can have a stronger presence at the consulates as well. So these are just a couple of the small examples and a broad overview of the work that we've done. And I want to leave more time for questions. Thank you.
Well, Diane, thanks. No rest for the weary. Finish the census and then jump right into another complex and multi-layered initiative that is so important and literally life or death. So thank you all. Those presentations were powerful, they were important, they were timely, and it really is impressive when you see all of it in one place at one time. So thank you. I did have just a couple of announcements isn't the right word, but I know, Dr. Kroll, that the county executive and you have been so clear, and I'm so appreciative of your continued support for these initiatives in moving forward. And I know there are some challenges with regards to working out the federal funding, but there absolutely is a commitment, and we know you continue to have it in ensuring that these efforts continue. And so the full funding is committed for the upcoming year, and if necessary, and a supplemental is requested once the federal funding runs out. You know, we have received assurances for both you and the county executive. I just want to let the public know and these incredible partners know that this effort will continue, because everyone acknowledges it must continue. So thank you for that commitment, Dr. Kroll. Didn't know if you wanted to add anything to that. Didn't want to put words in your mouth, but I know you've been consistent all the way through, and just wanted to give you the platform publicly to say so.
Councilman Alvarez, thank you. Let me just start by saying, at the start of this, I thought this is going to be an interesting session to hear all these partnerships in play. I had no idea. I have been just blown away by the things that when you hear it and see it in one space, and I know because I'm in it up to my elbows from day to day, but to hear it all at once in one place is really phenomenal. So I really appreciate it. There is no question, in all seriousness, there is no question, Councilmember, that we are a long way from done with this pandemic, and I think COVID is not yet done with us. And even as I said earlier, past the time when the virus itself has left, we are still going to have a long road of recovery, and we're going to need the support and the creative energies of all of these partnerships that we have that you see here today. And the county executive is committed to continuing our process, this process going forward. We know vaccination and testing have to continue, and the supports that we're talking about are going to continue as well. So the federal funding gives us some confidence that we'll have the resources to do that, and we will draw on those resources as we need to make sure that these initiatives and all the other things that we're working on and have to do are also continue into the new year. So thank you all.
Thank you. I have questions, but I want to defer to Chair Navarro to ask the first round of questions and opening comments.
Thank you very much. Wow, this is extraordinary. I really don't know where to begin, because every single initiative really has been just spot on, and I am just so inspired. The best practices that are being implemented are really, truly incredible. So thank you so much, everyone, seriously. So I think that just generally speaking, as now I think each and every single of these initiatives, are up and running, are doing, the amazing things that they are indeed doing. We have had conversations about not just, of course, continuing to support their current efforts, but enhancing that. And one of the things that came up, I think it was Mary Center who talked about this issue of identifying sites, and I would love to make sure that we have all the slides specifically for the needs, so we can, kind of track that as we're working through budget. But I was curious about, if Dr. Stoddard is still around, the conversations that we have had in terms of being proactive, given that we know that the supply of vaccines, notwithstanding the issue with Johnson & Johnson, but we do know that the supply of vaccine is going to continue to increase. And so now that the initiatives have been, have started to pivot into the realm of providing vaccines, et cetera, I was wondering if there had been, if you could share a little bit of the work that you've done so far to engage them, but also have you begun this process of figuring out where can you expand, where could you strengthen what we might have in place, and the role that these particular initiatives can play, again, once the supply begins to increase exponentially, and we're all just kind of up and running to get everybody, vaccinated. It's more like the logistical piece of all of this.
I'd actually like to let Dr. Kroll start off with an answer, because I think HHS is making a lot of these determinations, but I'm happy to add any comments to his answer. I'm sure it'll be more exhaustive than on mine would be. So
awesome.
So thanks, Dr. Kroll. It is. We have been working. Public health and HHS have been working constantly around this issue, not just with our local capacity, but with some of the other partnerships around the county. The work you've heard that are going around the state, the work you've heard with described earlier about the collaborations with the strike teams and with the state equity teams has this locus with Dorkeen Rosarian in my office to try to identify sites that are available, sites that are interested, places that are interested in doing and hosting sites, but also partners who are interested in doing vaccination sites. And as doses become available, or in doing the actual dosing. So marrying those two groups together has been part of the first and second part of that. And the third part of that is, of course, identifying doses and getting vaccine available. So that effort with the state doesn't provide vaccinators, they only provide doses. So we need sites and we need folks who can do vaccination. And that's where our partnerships come in. The federal strike teams are providing vaccinators and doses in theory at this stage of the game. And so our challenge is to add sites to that. And then as we get doses, more vaccine available, our goal is to increase the doses and partnerships with our partners, this group of partners, but also other partners as well, so that we can continue to get as many partners in place as we can. There is every belief that ultimately there will be providers in the community, medical providers, primary care providers that will have vaccines. We have no idea when that is happening. So we are not acting as if and waiting on it to happen. We're busily trying to figure out how do we expand and get doses into places where they need to go, and get providers and supported in ways that keep us alive and floating and in vaccine if we can. The other piece of this for us is really continuing to work within this partnership to identify where those doses need to go. And we're aligning and working with the pharmaceutical industry and the retailers. In fact, I think we have a meeting that the Councilmember Hooker is helping to facilitate that is identifying with Safeway, I believe, this week, to look at getting vaccines into to partnering with them around and getting them to vaccinate in critical areas or in critical communities as well. So. Our hospital partnerships continue to grow, and I believe Holy Cross is interested, as is Adventist, in helping to identify strategic partnerships or locations where we can do vaccines. So it is coming together from multiple different directions now, and it's been and Dr. Stoddard will comment on this, and maybe Dorkeen will too, but it has been as you all know from watching this, that there have been a lot of players coming from a lot of different directions. And our task now is to figure out how we identify those sites that Dr. Gomez is talking about and match them with folks who are ready to vaccinate. And if there's a match in place and it's doses, then it's the last piece of this puzzle. Let's get the doses to where they need to be. And all of that is being worked on continuously by our folks in public health, by Dr. Stoddard, by myself, Ms. Rosarian, and others. So it is, at this point, a race to expand as quickly as we can and get as many doses into play as fast as they're available. So I'll stop there. Dr. Stoddard, I don't know if there's other things you want to add.
Yeah, I just wanted to say that there's this intrinsic balance that we have to strike between volume and getting closer and to communities that we know need the vaccine. And so obviously when you do mobile opportunities, for example, those are inherently going to be lower volume opportunities, but they're critical for making sure that we have equitable access to all communities. On the flip side, we know that larger vaccine sites like the mass vaccination site in Germantown are not accessible to all of our residents equally, but they also help us push that volume of total vaccine, which does help the community intrinsically. And so there are these two balancing points. And as vaccine becomes more available, and you have higher volumes of people vaccinated, you need to move intrinsically lower into the communities in neighborhoods, apartment buildings, churches, and things like that. And so you'll see this natural balance and shift over the progression of our vaccination effort to get more closer to people who have not been able to access the vaccine through the large scale sites. And I think that's just sort of the natural flow. And so what the vaccination effort looks like today is not what the vaccination effort will look like in a month or 6 weeks or 2 months. I think that's sort of a natural progression that you will see. And you've heard it alluded to throughout the presentations today, where we're going to continue to make vaccine available through smaller, more niche opportunities and balance those with the large sites that get so much of the fanfare, but ultimately do not necessarily always serve all the residents equitably.
So I would add, one thing I would add to that is that there's a public health element to this. I mean, public health's role in this is as more vaccine becomes available and distributed more broadly, it allows us to do more of this tighter in, more niche vaccination. When we look at the data on 65 plus, we see a fairly large number of folks who've been vaccinated. There are still some folks out there who are 65 and 75 and older that really do need some in-home, some home-based vaccination, some of the efforts you heard here, some mobile vaccination efforts. As we go through this process and get through the folks who can come to large or moderate-sized vaccination sites, we're now talking about smaller, more localized and highly focused sites. Mobile Med has been doing some work, for example, with on those fronts to try to identify folks that are that they can register one day and vaccinate the next day in a local, very close targeted community within a few miles or within a few blocks of where the food distribution networks are. So that's our goal. The equity framework that you've heard that we share with you will be constantly shifting as more vaccines become available. The goal being, how do we now get to harder to reach communities?
Yeah, so I really would love to be able to see how we are beginning to put that sort of on paper, because we do have this wealth of expertise right here represented, and I always want to take a step back and make sure that our public knows that all of this effort was driven by data, right? So when, last year in the summer, when Councilmember Albornoz and I had a meeting with County Executive Elrich to look at the data and the disproportionality that we were seeing in terms of the Latino community having the most cases disproportionately and our Black community having higher mortality rates, we came to him and said, here's the framework. We need to have the targeted COVID-19 initiatives right now, because what we're doing is not getting to that particular granular level. And immediately we picked up the phone and said to our colleagues, Councilmember Rice and Jawando, hey, here's a framework for the Latino community. It'll be the same with some adaptation to our Black community. Can you guys work on that? And that gave birth really to these two extraordinary initiatives. And then we said, although the numbers for our Asian Pacific community didn't seem as skewed, we know that there are going to be issues there as well. So let's see how we can target. And so the good news was that we already had the infrastructure in place. It wasn't that difficult, but we also understood that it was going to take a lot of joint creativity and expertise, because the pandemic, obviously, it's something we had never seen before. But it's important, I think, to also remind ourselves and the public that as we're following that data, let's not forget that these three particular initiatives, if you think about Montgomery County, they represent over half of our county's population. Mm-hmm. Over half of our county population is comprised of our Asian Pacific, our Latino community, and our Black community. And so in order for us to really get that handle on the pandemic, which is what we're trying to do, these initiatives are pivotal. These folks that are here virtually are pivotal. And so I really would love to see how, in consultation with each of them, how can we come up with that kind of sort of logistical, triaged sites and or capacity, so that we can be ready when those supplies begin to increase. We're ready to go. We get lost, I think, in my opinion, a little bit with the conversation about, the equity plan and all of that. Sometimes I think people think that that's just targeting, small pockets of the community. And in reality, this is who we are. We're half of our population. So I just would like to see something a bit more specific around the conversations that have been had with these, amazing folks, and see how we can then, make that a reality. So we're matching, as you said, as the volume continues, because the truth of the matter is that there are still a lot of people in these communities that still have not been able to access, obviously, things like pre-registration, or, messages are still going through there. And the folks that you see around here, I think it's the all-star team of Montgomery County, really extraordinary expertise around how do you go deep into the community. This is what they've done in their careers. So I just would love to be able to, to see how we are starting to position so that when the moment comes, we're not saying, well, we're having the conversations. We're saying, here's the list, it's ready, it's vetted. let's go, let's do it. So I just like to request that, just to take a look and see where we are.
We can do that. I think, in fact, I would say that the work that Diane didn't talk about today was the work of the community partnerships that are looking, and those regional service sites that are looking at every site that's offered as a potential site, vetting them to say, yeah, we know this community, we know this is a site that will work, this is a size site that will work. Now we just got to match doses and partners. Dorkeen is working on that for us in the county, but also working on it with other partners. One of the interesting challenges is I promise you that no matter what day I give it to you, it will be old. Because there are folks who are coming out of nowhere with sites and places that they want to have that we think are viable. I want to start. We can start, and we'll do this as a request to Dorkeen that we pull together the group for the partnerships, the leadership of the partnerships, to talk about those sites and share those lists of sites so we know where they are. I don't know that there's a when it comes, quite honestly. This is going to continue to flow and gradually, and we're going to be constantly matching sites with folks who can do vaccination and growing this initiative. And then the last thing I'll say is this, that by intent, each of the initiatives is free to we have a basic agreement with them and a contract with them to do the work and funding to support some of the work, but by intent they have been able to go and seek other doses and from other sources, and so they've done that without necessarily talking to us about it. We look up and they've done it, which is phenomenal, but also means that mapping it is a challenge. So what we have to do now is come back and circle back and ask the groups to come back to us and share with us where they are so that we can give you that map. We can do that.
Thank you.
Thank you, Councilmember Navarro. Councilmember Katz.
Thank you very much, Mr. Chairman. I was busy on mute over here, so I had to figure out how to unmute. First off, thank you all very, very much for everything that you're doing. It's been said time and time again, it can never be said enough. You save lives, and you do it each and every day, and you do it perfect. You do it in the perfect way it should be done. So to Dr. Colin, I've already sent him at least one church that is looking for a partner, for a supplier, and I know that you're working on that. But any idea when that might when you might be able to find more and more people that can deliver the vaccine directly in the community where we need it delivered? And you're on mute, Doctor.
Yeah. So we are, when we might be able to find more partners who can deliver a vaccine or more vaccine. I'm sorry.
No, well, both, but of course you need, we have the partners, I think but with the church that contacted me was concerned that they didn't have a supplier who the CVS's or the Safeways or whoever. Yeah.
So that is part of our ongoing quest around this, and it is purely at this stage of the game matching partners with providers. We have matching sites with providers.
Yes.
And one of the things I'll do is we'll take a look at where we are in relationship to the numbers of sites and numbers of providers. The sites easily outnumber the providers. So everybody that you get goes into a queue for us now. And I think that from going forward, it is where does Salud have in their schedule? What do Mobile Med have in their schedules? Is something that one of the hospitals can take on. And that process is just going to be iterative, just to figure out when in the queue they can get there. And we're working now to identify at least 2 additional providers that I'm aware of in just off the top of my head right now that we may be able to partner with and contract with to add vaccine delivery to our capacity.
Thank you. And of course, we all know that we need to continue this. The funding has to be there. The ARPA money is appropriate, but so how is it going to work after June 30th? Are we going to backfill? How are we doing all this for money?
So we have, I don't know, this is maybe a joint conversation. I think we have somebody from budget on to maybe help with that with some of that answer. But, you know, our approach to this has been, we will fund what we know we need to fund to keep going. We have used the HHS budget as a way of doing that, knowing that we can raise our spending limits as needed, and also knowing that when funding arrives, we can journal entry funding and apply it to backfill any gaps that we've created in our budget. So that was how we started this process last year. I think that is likely to continue. If to the extent we have funding that's already appropriated for this going into FY22 or set aside for it, we will be able to do those contracts and do that funding in advance. And we will also, as we put budgets together, send them over for either amendments to this year or supplementals into the next fiscal year for the council's consideration.
Yeah, and that was the next question, is for FY22. I guess it's going to need to continue, and I'm sure you have a plan, but we need to make certain that we have the plan.
We are working for these initiatives. I'm sorry, on the budgets. We're working for these initiatives on their budgets now for FY22, with the intent, I believe, in sending over an amendment to the budget and submitting those before we wrap up the plan for FY22.
We did note, Councilmember, that we did, I believe we were informed of approximately $19 million that the state had provided through a FEMA pre-approved project. I believe half of that money has been front-loaded, and I think that the second half comes in the next fiscal year. I believe that's how it's going to work once we demonstrate we spent the first half. So obviously that will go a significant direction to funding all the vaccination efforts, including those done by the MHIPs and others. There also in the ARPA, there was specific vaccination related funding as well. I'm not sure it's entirely clear how that's going to flow down and what percentage that's going to be used by the state and others, but we would expect there to be additional federal dollars to support vaccination and testing efforts as we move forward, in addition to the local county funds that the ARPA provided directly to Montgomery County as well.
Thank you. And I know that it was mentioned earlier, but you know, the people who receive the vaccination still need to make certain that they get tested. I mentioned it on Tuesday that a friend of mine was on Facebook, and I called him afterwards. He had received his second vaccine back in mid-February, and he got COVID last weekend. And you know, first off, you sort of believe that when you finally get that second vaccine, that you're can walk in and jump off of tall buildings, and obviously you can't. That we all still have to be careful, and it certainly brought it home for me. I'd heard professionals say it directly, but until my friend said, "Oh, by the way, this is what happened to me," it certainly brought it home. And I just want to end on Diane Vu. That is one of the best pictures of someone who's not on Zoom at the moment that we've seen. I just want you to know that. I was just very glad that it was you rather than Andrew Friedson, but anyhow, I'm very, very impressed. So thanks. Take care.
Thank you. Councilmember Glass.
Thank you very much, Mr. Chair. I really learned a lot this afternoon, and I appreciate each of you and your organizations taking the time to share with us all the work that you've been doing, because I know a lot of times we don't get to hear all of the coordination and the planning and the strategy and the teamwork. And so thank you for doing that today and kind of lifting the veil a little bit. And, you know, my colleagues have asked some really good questions, and every Tuesday we continue to ask questions of our team, the folks that are here, and we continue pushing them and pushing ourselves, quite frankly, to be as best as we can be to make sure that everybody is healthy and safe in our community, and especially the communities that you all serve, recognizing how disproportionately impacted our BIPOC communities have been, both from the health effects of this pandemic, but also the economic effects as well. And that is a separate conversation that we're all working on together. But the one question I just have is regarding the misinformation that is out there. And I'm curious to hear how each of your organizations are, in your outreach, what pushback you might be getting. And particularly, we talked about this yesterday with the Pfizer news. If there is hesitancy, how you are trying to dispel any myths or rumors. My staff has shared with me that family members have been receiving WhatsApp messages saying don't get the vaccine and all of these things. And so I'm just curious how that tugging and pulling might be trying to convince some hesitant members of your own communities to get vaccinated. And I don't know where to start. I guess I'm looking. Yeah,
I can start. This is Maria. I can start in the Latino Health Initiative. I'm sure can elaborate, but I think that this is where it's really, really important that all the work that the Latino Health Initiative and all the other initiatives have done continues to move forward, right? Because, for instance, I think the one way that we do it, of course, is with media and all that, all the fancy stuff, the social media and the regular media. But another one is just really people to people, right? Is our community health workers that are out there talking to people, going to each event, who are neighbors, people who can speak from like, they're also frontline workers, they're also parents, they're also people who have gotten the vaccine and haven't grown horns or haven't grown a tail, and they can say, here I am, So I think that's one way that I think I want to play that while that to answer your question, that this is one way. The other is to remember that we need to continue to move forward, and this piece is what is being funded today, and for the next chunk of funding should be something that we keep thinking about, something that keeps going, not just for this pandemic, but how do we make a community to continue to have community presence so that any other kind of emergency that we're ready and prepared, and that we're not having to start all over again from day one. And I just wanted to say that the Latino Health Initiative, along, I'm sure, with all the other initiatives, we are more than ready to move forward, to expand our work, to make sure that we're answering to the needs of the community, and that right now, more than ever, I think we are working, the steering committee is preparing a budget for you talked about the budget that's coming up. We are spending our weekend trying to make sure that budget addresses the real needs of the community. So I just want to thank the Latino Health Initiative for working tirelessly, really, to make sure that we are not only answering to our community, but answering the budget so that you guys can have the right budget that answers to the right community at the right time.
Well, and I'll just say, real quick, I'll just say that your suggestion and advice we know to be spot on, which is why we're having this conversation. When a few months ago, when we realized that the vaccination rates were not where they should be in our communities and certain communities, the light bulb went off in many of our heads and say, well, we just had a year worth of outreach from the census team, and I appreciate the two chairs scheduling this conversation, because that was the nexus point. Let's get people to the doors. Let's have face-to-face conversations, and that's how you build trust. And so, excellent point.
Thank you.
Can I? Sorry. This is Dr. Izquierdo from Care for Your Health. I want to make a point because I hear about hesitancy, and it seems to be the first thing we talk about. In informal surveys we have had of the Latino community, 75% of Latinos want to be vaccinated. So right now, the issue is not the hesitancy. The issue is getting shots in arms. Now, the reality is that we need to make sure that the sort of sources of information that are reliable and linguistically competent, both for the initiatives and as well as the county as a whole, exist. Because once we're done with the those 25% are gonna be really hard to get to, okay? If the current ones are hard to get, those are gonna be even harder. So I think planning for all the sort of how to tackle the misinformation and stuff, but right now what I'm seeing is interest in vaccines and a need to be basically informed. I am not encountering, there are people that I see that are like, oh, I'm not getting this. But the majority of people are like, where do I get it? What's the difference? Which one is the best vaccine that I can get right now? Should I choose? Should I wait? Should I go forward? So I want to mention this because there's all this effort around hesitancy. And I'm like, okay, you take care of that. I'm going to go and give shots because there's a lot of people that need them right now and that we are not able to give them to. So again, I think this is an important work that we need to plan for going forward because it's going to happen. But I don't see it being a main concern right now because there's so many people that want it that haven't gotten it. So
Thank you for the level setting.
Could I speak up? Because I do think, and I'm only speaking for me and my organization perhaps, but there are cultural variations. From my observation of the African American community is I'll start my video. I don't believe the data shows that they're 75% ready to take the vaccination. And I do think that the Johnson & Johnson bubble is not a great timing. But what I do think in terms of trust and engagement, and we've had some conversations, Ollie, Darkeen, Ralph, and I, we've had some conversations about how important it is for those of us who represent the community, are in the community, who have been vaccinated, who can say, look, and I'm good. And it's really personal, is true, but it's also personal around really bringing to the table that this is something that you can survive. It's still a real thing. I know I have 75% of my employees, and I have almost 300 are African American or Black, African, or Caribbean, and half of them are not interested in taking the vaccination. And these are educated professionals who are saying everything, they're using scientific terms, they're reading the media, etc. So I do think it is, I just want to say to you, Councilmember Glass, it is an issue that has to be addressed culturally specifically. And I think it does look different in the African American community because of the narratives around it. Narratives that say something like, we're going to be the first ones to get the Johnson & Johnson with a lower rate. And then this happens, go like, they're supposed to say, see, I told you we were going to get it disproportionately, that one shot, that was a game for us. So there's a lot of narrative. And I think the only way we can really address it is to go to the spiritual base. And the spiritual base is either, I'll be candid, this is just my opinion, it's either the churches or the fraternities, sororities with their Christian base, meaning that those institutions that are still trustworthy in the African community, when they're hosting the vaccination and the testing, it will lend credibility to those who are actually doing the outreach. We're going to have to mobilize, and that's what our initiatives try to do. We have to mobilize the churches, the Islamic centers, all of those institutions that have credibility. People will still listen to the imam or listen to the pastor. We have to use that strongly.
Excellent perspective as well. Thank you, Dr. Chapman.
And can I just also add, to piggyback off of what everyone has been saying? I mean, we have spent a lot of time looking at this, and we spent a lot of time looking at this through the census. And as Dr. Chapman mentioned, you know, there are different reasons as to why people are hesitant or don't want to get the vaccines, and it's nuanced between communities. And so we spend a lot of time having conversations with direct community members. We issued surveys. We've worked with the health initiatives and partnerships to do focus groups to really get at the reasons so we can counter message and target our messaging based on the nuances that exist in each community. So our strategies and our tools may look different from community to community. In one community, we may be using WhatsApp. In another community, we may be using radio and WhatsApp and text messaging. So the messaging and the strategies are really guided by the community members themselves. And where the other really important thing is, like Dr. Chapman and I can't remember else who mentioned this, but to work through the trusted voices and they're particularly, the faith community leaders, but it's also the community needs to own it, right? So it's the person, the neighbor, it is the PTA person, it is the grocery store worker who is owning the messaging and putting that out to their network. So it's really those type of strategies.
Councilmember Glass, just a note on this. This issue of hesitancy is one that we've been wrestling with for a long time, and it's clear that it is a packed word that we need to unpack now, and maybe even stop using the word hesitancy, because I think there are some folks who fall into that quote hesitancy label that mean absolutely to not ever take this vaccine. Then there are folks who are sitting on the fence who are not quite sure which one is the right one for them, or not quite sure if they should. And it's that group that we are most anxious to try to reach and understand. One of the things we've talked about with Diane and the community partners is the need to really talk to the folks who are hesitant, to hear why they're hesitant, and to understand what it is that might shift them one way or the other. Certainly J&J didn't. The thing with J&J this week did not help, especially around the single doses. But it is, as we get, the other thing that I would say is as we get through the age ranges, we are now in the 80+ percentages of folks who are 65+ and getting vaccinated. There is a group in that range that are remaining that will still be hard to reach, that we need to reach, to Dr. Izquierdo's point, but there's also a group that may be reluctant and unwilling or hesitant to take the vaccine. So we've got, as we've moved through this process, continuously to message around reasons to take the vaccine.
I think you're absolutely right, and I'm even hesitant to use the term, right? Not that you want to reinforce this stereotype or this stigmatizing situation, but in political terms, quite frankly, you're talking about people who are movable, who just need that face-to-face conversation, who need that direct communication, and whether it's WhatsApp or any other digital format. And to a point that all of us have spoken about for the last year, that communication cannot be relied solely on Google Translate. It needs a real person to translate into either the dialect or the nation of origin specific language that can help a person understand why this is important. And so I'm cognizant of the time. Again, I just want to thank all of you for the work that you're doing, and please let's stay in touch as you work to keep all members of our community healthy and safe.
Thank you, Councilmember Glass. Good questions, good points. Councilmember Friedson. I almost said Dr. Friedson. Councilmember Friedson.
Yeah, no, I wish. Don't tell my mother wishes more than anything, probably. Well, first of all, I just wanted to echo Chair Albernaz's comments about you, Maria Gomez, and all of the work that you've done. And so I just wanted to add my voice to the chorus of gratitude and appreciation and admiration, and just wanted to make sure that I noted that. It feels like a long time ago with a lot of substantive, amazing information in between, but I didn't want to allow this moment to pass without saying that. So thank you. And then I will also, didn't want to allow the moment to pass to thank the co-chairs for all of their work on this effort. I don't think that we would be in this conversation but for their steadfast efforts pushing the county to do this type of partnership. And so I just wanted to take the opportunity to thank both of you. It really has made a difference. I'm recalling our first internal conversation when the issue of cultural and language competency in our outreach, when we barely knew what this was and how it was going to work. And that conversation began in the very beginning of this. It was exposed to be even more challenging than I think any of us imagine, both the crisis itself and the challenges that we had that were frankly exposed in terms of our limitations with how we communicate with the community. And on the go, we have all stepped up to address it. And to your credit, Dr. Kroll and Dr. Stoddard and Ms. Mora and your teams, it hasn't always been perfect, and we've had our lumps along the way, but in an extremely difficult and challenging environment, I am proud of the way that we've been able to step up and adapt and work through this. And none of this would be possible, most importantly, without the community partnerships that we have. I think that it's a model moving forward and something that we should be building upon. It shouldn't have taken a crisis to work out some of these issues. I think we can all acknowledge that, but in the face of the crisis, I think we've learned a lot, and we're certainly not through it. There's a lot more that we need to do, but once we fully vaccinate everybody and we get through this current crisis, there will be a next crisis, and there will be the day-to-day challenges that our residents face. And I would hate for us not to build on the strength and from the lessons that we've learned in this unprecedented moment, and use that as a baseline to deliver services and to help our residents as well as we possibly can. Hopefully not just to survive, which is what this moment has been, but to thrive and to be their best selves, and for our community to reach its full potential. So I'm really excited about this. I really am grateful. It is amazing the similarities and differences. We talk about this as a individual effort, but it's really the collaboration of about 1,000 targeted efforts that have all been brought under one umbrella. And even the last conversation about hesitancy, I think if we made any mistake, it was this idea that hesitancy would be our number one issue. That's one of many issues and challenges that we have. Access certainly is a major issue as well. And not every community is the same. Not every person is the same. And I think that if we've learned anything from this, it's the targeted outreach within communities, between communities, among communities, recognizing that everybody is different. That's where I think Ms. Vu, your team, and the lessons that you all have learned, and the strength that you have from the efforts with the census, have really brought a major competency to county government in our way that we work with community partners and reach communities that just we're not used to proactively going out and reaching. Government used to be an entity that you went to, and I think we're changing the way that government works, where we have to be an entity that goes to the community, that brings the county government to the community. It doesn't expect the community to come to the county government for resources and for services and for access. And I think, Ms. Vu, you and your team are really, on the front lines of that work and what it means. So thank you for that. And I think that is something that we can build on as well, not just the community partnerships, but in utilizing the strength of your office and the assets that you bring to the table to be able to move these issues forward. And the three things I heard a lot of, I mentioned competency, and obviously that's a big part of this: cultural competency, language competency, operational competency. Just I think there's credibility, that we need to focus a lot on. It's who are the people who are trusted in the community, and how do we utilize them? What are those voices? And then clarity of information, where there's so much conflicting information and there's a lot of noise out there. That's not unique to one community or another. It's more challenging when there are layered other challenges on top of that. But we have to be able to cut through that noise with trusted folks within the community, and whether that's as was discussed earlier, whether that's as Dr. Chapman was talking about, whether that's your church, or whether your faith community, or that's your fraternity or sorority or some organization, some trusted leader within the community that is able to serve as an ambassador for the county. Unfortunately, those of us in public life are no longer the most trusted people in communities. There's a certain sadness for me in that, but I think that's a reality that we have to face. And so the question is, how can we in government partner with those who are the most trusted to be able to get the information to folks and ultimately the service to folks? So I don't really have a question. It's just a lot of comments, and mostly it's a lot of gratitude. I think there's a lot here to build upon, and I am interested in how we get the rest of the vaccines out to those who desperately want it today, how we get the information out to those who might need more information before they're convinced and ready to do it, and then just as interested in how we set ourselves up once we get through this challenging moment related to testing and vaccines and this current crisis, for how we build a foundation and utilize this apparatus, this powerful coordination and collaboration that has been built with a lot of work that you all have undertaken, and how do we utilize it in a way that can be part of the way that we do business moving forward in a non-crisis environment, because I think there's a lot to build on here. So thank you.
Thank you, Councilmember Friedson. So I guess in the 5 or 10 minutes that we have left, I want to end or begin my comments by where you just ended yours, and that's thinking about the future. So there obviously have been tremendous innovations that have happened over this last year. We received an excellent report from the Office of Legislative Oversight and a briefing from the Mary Center on their work around telemedicine and telehealth. That if done well, and if we address the issues of the digital divide on the front end, and we're very systemic and comprehensive in our approach, telemedicine and telehealth can be a tremendous, tremendous tool moving forward to address some of the disparity issues that we all are aware of and have been spending our entire professional careers tackling, but haven't been able to curb in the way that we all would like. And so I think that's one example of an area of innovation. The network of Black doctors, hugely important, and also a tremendous opportunity. And Dr. Chapman, I want to highlight something you said, and I'm really happy you said it, and I've had this conversation with Dr. Kroll. We are blessed to have NCCF right here in Montgomery County doing the work that you're doing, and I am blown away by the 40+ partners that you identified in your presentation. But you're right, there isn't the same infrastructure in our African American and Black community as there are in other communities in terms of community-based organizations that can be stood up quickly to address the holistic needs moving forward. This is an opportunity for us to do a deeper dive, to invest more in the organizations that are already doing this, to increase their capacity, but also plant seeds. And oftentimes these organizations are born out of crises like this. I'm thinking of the hubs. Our faith-based organizations have stepped up in such a powerful way, and as an institution have an infrastructure in their own right through the power of volunteerism and tremendously talented members of their various congregations that have the organizational capacity and interest in expanding their work. So that's an area I want to explore further coming out of this, because we have this infrastructure that was there, but we've added to it, and we need to continue to add to it, and we need your guys' leadership and direction on figuring out where to add to. So
I would just like to make one quick comment in terms of this model. One of the basis of bringing together so many groups, if you'll notice, our partners that are helping us deliver the services, we reimburse them for their costs within 10 business days because they're not able to sustain past that. So you begin to look at what does it take to support a small nonprofit or profit proprietary. 10 days. Now you do know the county doesn't pay us back in 10 days, right? So that really speaks to the fluidity of a model that supports this new growth of small entrepreneurs and nonprofit capacity that's Black-led. It's just not been supported by the county over decades. We're large, but we weren't always large, so we know exactly what it means that you can't pay your people, and then you want them to come back to work a month later, and they're saying, when are we going to get paid? We know what that feels like. So that's powerful. So I'm glad that you see that this is an opportunity to build a broader based network of small Black-led, African Caribbean and African American led nonprofits and businesses, because that's key to this diverse community. It's key to our economic survival.
Well, and I really credit our GO committee who's been tackling this issue for quite some time. And so it's serendipitous that we're doing this as a joint session between GO and HHS, because I do think in the next phase of this, we need to think about it in those terms, not just from a health and human services standpoint, but from a procurement standpoint and a development standpoint. Because, you know, when Maria Gomez in 1988 started putting the pieces together for the Mary Center, and the organization has grown to what it is now, you know, it started somewhere. And so, and it had the foresight of policymakers at the time to make those investments, to make it easier to make those investments. This council has laid the groundwork through our racial equity framework to make it easier. And we've made dramatic improvements over this last year, thanks in large part to Nancy, frankly. But this is the next phase. So I want to pick up there moving forward. And I do think there's an opportunity, Dr. Kroll, and I know everyone is totally and completely overwhelmed and exhausted. And frankly, I don't know how you guys have done what you've done this last year, because I know how hard you've all worked. But I think some kind of, after a few months of the dust settling and things improving, I think a report of some sort, thinking about, you know, what has transpired over this last year, from the racial equity lens, from the equity lens that we've been working so hard on, and the plan that we've had in place, which I think can be the perfect backdrop for this public health summit I've talked to you about many times, and I think could be the perfect vehicle, you know, in the fall, late fall, when we're far enough removed and have had a chance to catch our breath a little bit, but not so far removed that we don't remember what we've all been through this last year. I think that would be the perfect vehicle. And that could be the launch to plant some of these seeds. And I think, you know, to continue this really important and relevant work. And of course, I haven't mentioned yet our AHI folks who have been doing such an amazing job. And I know there's a proposal before us right now, which I know all of my colleagues are going to unanimously support. And to Dr. Kroll's credit, he's already on record saying he supports, and I know the county executive as well. And I think it dispels some of the myths within our Asian community that have really just been, over this last year, painfully, as we've all seen, exposed. Those myths are not real. The pain and the anguish and the needs are real. And there's, you know, we've got to break through the stigma as a community collectively together. And I think the proposal that they've put forward really is an important down payment to addressing some of those issues. So those are a little bit of rambling thoughts there, but wanted to share those thoughts. And Councilmember Navarro.
Yeah, no, I really do think that what Dr. Chapman has just brought up is important, because it is feedback that we have heard, especially through this crisis. And although they have all stepped up extraordinarily, it has, I think, shown some areas that we need to address. And you just, you know, framed it beautifully, especially through now our racial equity and social justice lens. This issue of how are we supporting, how are we, you know, growing the infrastructure, especially with our community organizations and our communities of color, is absolutely central. So perhaps one of the things we're doing this year with our budget is that we're focusing, it's kind of a streamlined process, but in September, we are going to go deeply into particular policy challenges. And so I would propose that we have a joint session to talk about this issue of our nonprofit organizations within our BIPOC communities, and see where there could be Maybe we put together even like a very short-lived work group. But I think this is very important. And even though we've tried through things like, streamlining the grant process and figuring out who goes into the base budget and who do we provide, technical assistance to and capacity and what happened to the incubators, and all of these questions I think are so relevant. And so I would like to, propose that as a joint committee for perhaps the fall. And meanwhile, these partners can begin to sort of, I'm sure they already have identified a lot of those spaces where the gaps exist and where we may be able to step up and provide that bit of, additional support. I mean, after all, that's what equity is all about, that additional support to strengthen that infrastructure in our communities, because we've seen, again, with this pandemic, a clear example of why we have to be ready in that sense. So as a former person who, launched a nonprofit organization from the basement of my home in Wheaton and had to grow it, I absolutely, and I know Councilman Albernos has done similar, and Councilmember Glass, absolutely know that this is pivotal. So anyway, thank you. I would love for us to do that.
Thank you. Great. Well, this has been such an important discussion on so many different levels. Maria, did you want to say something?
Yeah, just really quick. I can't leave this behind. I just want to say that with the opening vaccinations to children very soon, we will have another challenge, I think, and we must put the same energy and I think resources into this community to make sure that our children can have the rigorous and fulfilling 2021-2022 school year in great health, because as you know, the improvements have to happen because our children have fallen behind so far. And I just want to put the plug in for that, because we need to vaccinate those kids. And I think we're going to have another challenge. I don't want to call it hesitancy, but just another challenge in terms of what does that mean for children.
So amen. And the mental health and behavioral health, we've had a couple of sessions on that with the joint education and culture and HHS session, but you're absolutely right. And I was going to, as part of my questions, ask about youth engagement, but there's just not enough time today. But I would like, as a follow-up, for us to have that conversation as well, because in addition to the vaccine, which is so important, we have to have the infrastructure in place. I mean, we don't know what's waiting for us as kids come back to school. And we're already starting to see some evidence of the trauma that all our kids have faced disproportionately in certain communities. So, we are going to have to come together once again around that issue, which is so important. So, Dr. Kroll, any final words? I saw like you might want to get in for a final word.
I did. Thank you very much, Councilman. Thank you once again for all of you and for the time and for the energy of the group and for the thoughtfulness of the conversation today. Councilman Albernos, as I'm looking forward into the fall, you're talking about a summit and at a point where we begin to do some work on that. That work has already, from my perspective, already begun in terms of thinking about what the lessons learned are from this. What are the things that we know we need to keep and grow? What are the vulnerabilities that we see in our systems and our processes? But also, we've been having conversations about what does the fall and winter look like? Not just in terms of COVID, but in terms of ongoing food assistance, rental assistance, mental health issues, the need to continue testing and vaccinating, but also how do we grow the gaps and close the gaps that we know exist now. For HHS, we are thinking about this as a reimagining exercise for us, and not just in terms of how we operate in the program and inside the walls of the department, but how do we partner, and who do we partner with, and how do we grow those partnerships, and where are the voices that we haven't heard that we need to hear in this process. I think we need to dig deeper and use one of the lessons learned around this is that there are partners that we haven't touched. We need to be in our communities of color that sometimes voices don't necessarily feel heard, and so figuring out how we make sure that those voices get heard as well. We're going to be in a nonstop battle for the next year and a half, 2 years, and coming out of this, I think we'll be stronger and better prepared for anything that comes down the pike, and it'll be because of the partnerships that we have here in this system. So I thank you all for the ongoing support. And as for fatigue, we're so far past tired, it's not even funny. It doesn't matter anymore what that is. So.
Yeah. Well, I hear you. Amen to that too. I know I've drank more coffee this year than a while. Anyways, thank you all so much for your leadership. It's inspirational, and look forward to the ongoing discussion. I'm joining many of you in a meeting in 4 minutes. So thank you all.